Good afternoon, honored members of the Government Oversight Committee. My name is Corinna Cohn, and I stand before you today as a proponent of HB68, a bill vital for safeguarding the well-being of gender-diverse youth in Ohio and preventing their unwarranted medicalization. At the age of 15, I was diagnosed with what was then known as gender identity disorder, but today is called gender dysphoria. And by the time I was 18, I was already on a trajectory to medical intervention, and I started estrogen treatments. By the age of 19, I had what was then called sex reassignment surgery, but its technical term is vaginoplasty. Today, I'm 48 years old, and I've gained numerous insights about this condition over the last 30 years. And perhaps the most important or crucial insight is that children lack the capacity to envision their adult desires and well-being accurately. In the past 2 years, I've testified in 3 states advocating for legislation to regulate gender-related medical procedures on minors. Texas and Indiana are 2 states that have already enacted laws to protect children from unnecessary medical interventions. If you had asked me 2 decades ago whether minors should be allowed to undergo gender transitions, I might have responded affirmatively, but with conditions. At that time, the practice of gender medicine adhered to more stringent guidelines. I personally required 2 clinical recommendations to undergo surgery. However, in recent years, we've witnessed a significant decline in the regulation and safety of gender medicalization for minors. How did my perspective change? And what questions should you pose to opponents of HB68 in this committee? Why should you support this legislation? I'll guide you through my thoughts. The first question: what if there exists a highly principled gender clinician in Ohio who only recommends medical transition when convinced it is in the patient's best interest? So we're talking about somebody who is extremely principled about how they practice. They want to ensure that any patients that they're recommending for medicalization or surgery are the best candidates for it. Well, what do you suppose happens when these families are told that their children will kill themselves if they don't get these treatments? They'll do what you would do with your own children, and they'll bring them for a second opinion. And then they'll bring them to a third opinion. And what we have seen happen in various states and countries is that the most permissive and lenient practitioners in this field will catch everybody else who's been declined and will put them on a medicalization path. It's how that will happen in Ohio if this bill does not pass. Second question: what if a child undergoes medicalization and the clinician deviates from the standard of care? What if the child later regrets the transition and seeks restoration? Who should be held accountable? Children cannot provide informed consent for these treatments. It's the parents who provide the consent, and it's the parents who are often being coerced into believing that their choice is a matter of life or death. In Ohio, and particularly in these circumstances, neither medical professionals nor parents bear any of the liability for these choices. It becomes nearly impossible for these children to seek justice, as the statute of limitations shields doctors and therapists from putting children on these pathways. The burden of risk falls squarely on the shoulders of these children, some of whom, in the state of Indiana, I have seen children as young as 4 being presented as gender patients. And what I can tell you is that as these children get into their 20s and approaching 30s, they're going to watch their friends start to have families, and they're going to realize they can't. And they're not going to have a real explanation why, because they will not have been parties to these choices. Now again, if you had asked me 20 years ago, I would have said 16-year-olds maybe know what they want. 4-year-olds don't, in any case. Third question: how can we establish genuine informed consent for gender medicalization among minors? New patients at gender clinics frequently hold unrealistic beliefs about the possibilities and consequences of hormone treatments and surgeries. Some gender clinicians even distort data while testifying before bodies such as this one. In such circumstances, no child or parent can provide any type of informed consent, as they are being misled by the very clinicians tasked with their care. Considering the substantial risks, the numerous unknowns, the medical profession's inability to self-regulate effectively, and the undeniable reality that children bear the entirety of the liability for these experimental procedures, I urge you to support the promotion of HB68 to the Senate for a vote. It is our moral obligation to protect the well-being of Ohio's gender-diverse youth and ensure they receive the care and consideration they deserve. I would like to make a note about the sports portion of the bill. Because I started estrogen at 18 and had castration, punectomy, and vaginoplasty at 19, and I'm now 48, excuse me, I have spent 30 years without having any testosterone in my body. I probably have less testosterone in my body than any person in this room. I have the wingspan of an adult male, I have the height of an adult male, I have lung capacity, I have the bone structure, I have most of what is needed by men to be competitive athletes. And I can tell you I play tennis recreationally, and although the men my age are a lot stronger than I am, my other advantages of being a male are undeniable. So I urge you to also support the female athletes in Ohio with this bill. Thank you for your time and your consideration.
Thank you.